This big, beautiful bill that the Republicans just passed in the House, and they're going to be sending it over to the Senate, if adopted by the Senate wholesale, that's not going to happen. There will be tweaks, but they're starting at such an extreme level that we should be deeply concerned about what comes out the other end, regardless of Senate input. This bill adds over $3 trillion to the deficit in 10 years. As an aside, can you imagine if this was a Democratic bill, like what the top line headline would be about the deficit and what was being added to it? If Democrats wanted to increase social spending but not add enough taxes to offset it, the headline would contain every zero. But because it's tax cuts disproportionately helping the wealthy, and the poorest amongst us who are on Medicaid or on SNAP are the ones that are going to be affected, it's just different framing.
It's evil framing.
Yeah.
It's taking food out of people's mouths framing. The headlines in every paper and on every cable news channel would show like every zero in that $3 trillion deficit number, and they have like flaming, put horns on the zeros. Like this is going to kill America. It's crazy to see how the immiseration of people is just not spoken about with the same urgency in our media class that adding benefits would create. Are people that might be harmed by, say, the largest cut of food assistance, are they represented in our media?
Unfortunately, no. And I think that's why someone like AOC is really important. We unfortunately lost two of our other members who are more connected to working class issues in Cori Bush and Jamal Bowman because AIPAC took them out. But we still have members of the squad standing up, representing the interests of working people. Here she is talking about what this bill is. The Republicans rushed this through in the middle of the night last night. She's speaking here in particular about Medicaid.
13.7 million Americans. 13.7 million Americans are the number of people in this country whose health care are going to be stripped in this bill. Now, Republicans are going to try to tell you every single distraction in the book from that essential number. I want people at home to understand that Medicaid and the federal matching funds for Medicaid can make up 30 to 40% of some of the state budgets that we have going on back in your home. Republicans have put this bill together, rushed it together in a matter of hours on the back of a napkin, shaking it, walking out of the White House, and brought it right here to this floor. They are defunding Planned Parenthood. They are ending tons of Medicaid coverage for 13.7 million Americans, including Affordable Care Act coverage as well. And if you want to get an abortion and have a silver plan on a health care plan that you paid for, you will also be affected by this legislation as well. Also, allowing suppressors on guns to be deregulated to some of the largest amounts that we have seen since the 1930s. This is just a Christmas bill.
I yield the gentlelady to 30 seconds.
And so I want people to understand, for my Republican colleagues who are sure what is in and not in this bill, in this process that has been this rushed, when you wake up in the morning, you will realize that you voted to defund Planned Parenthood and to take away health care from 13.7 million Americans. And when this country wakes up in the morning, there will be consequences to pay for this. And I yield back.
Gentlelady yields.
Well said. The bill, we're still getting these numbers because, as she says, they rushed it through last night, which is what people do when they're doing good things, right? You pass bills in the dead of night and don't allow much debate on it. These are the numbers. Let's talk about the tax cuts first, and then we'll touch on Medicaid. We've shown this graph before, but I think it's quite effective. Popular information, Judd Legum and crew put this together, showing the distributional effects of the big, beautiful bill, Trump's, I guess, riffing off of Build Back Better. It's so stupid.
Never an original thought.
Yeah. All grievance. You see the first quintile, so if you're making up to 17K of earners, you're losing around $1,000 in after-tax income by 2026. That second quintile, so this is, like half the country here? No, quintile. 2/5. Jesus. I did. The Cardinal sent me trying to do math on the fly.
I mean, it's close enough.
I was like conflating quintile and quarter, which is not true. But 17K to 51K in terms of earners, they're losing $705 in after-tax income in 2026 by income level. Let's just fast forward to the top 0.1% who are adding $4.3 million in after-tax income in 2026. That's as jarring as it gets.
They're going to create jobs. And I mean, this is all in the context of, people like David Sachs in February being the U.S. now has World War II levels of indebtedness without fighting a world war. Well, I would say we're kind of helping a genocide. Is that close enough to a World War II comparison?
Yeah.
So where did all this money go? The greatest generation incurred debt for defeat from blah, blah, blah. They're worried about this debt, right? But that is just like the sort of border hysteria about immigrants. That's just to drive people's lizard brain as these people steal money and make sure they take more from themselves, even more than they would, under a situation where they're not. Everyone listening to this knows that these people aren't taxed nearly enough.
We know that Republicans increase the deficit and the debt every time they get into power. Bush did. Trump 1 did. This bill is supposed to increase the federal deficit by $3.8 trillion.
Reagan did Star Wars. I mean,
it's just because it's a fig leaf for austerity. And to go back to my point at the start of our segment on this, if this was more accurately reported, perhaps Americans would have a better understanding of the true motivations behind this. But austerity treatment gets a different kind of coverage than broad-based social programs that are coming towards people gets. Just compare the Bernie Sanders agenda and how that was spoken about and how the spending was discussed in that. How are you going to pay for it? How are you going to pay for it? How are you going to pay for it? Republicans are cutting all of these programs, and the non-partisan Congressional Budget Office says it will increase the deficit by $3.8 trillion, and it's like, ho-hum. What are we going to do about it?
Which quintile owns your newspaper? Or which quintile owns the cable network that you see?
Right.
Which quintile owns all this stuff? Which quintile owns the politicians that are voting on this stuff?
Yep. The cuts to SNAP, food assistance that over 40 million Americans rely on a monthly basis are the deepest in the history of the program. When AOC is talking about the Medicaid cuts, Matt, you've talked about this a lot, but this is really important for people to understand. More than 66 million Americans live in areas that are classified as rural. Rural hospitals need Medicaid. 1/3 of rural hospitals in the U.S. are at risk of closure due to financial instability. The Affordable Care Act, when it expanded Medicaid to adults who have incomes that are up to 138% of the federal poverty level, they expanded Medicaid coverage to around 20 million people. This has been a success of the Affordable Care Act. And that expansion kept rural hospitals afloat.
Yep.
It kept them afloat because they have very low margins, but they need the capacity to take care of populations without making the money that, say, like a New York City or a Los Angeles hospital would be making. And there's been analyses done of Medicaid expansion states versus rural hospitals in non-Medicaid expansion states. 40 states expanded Medicaid under the Affordable Care Act. The 10 that didn't, Chartist Group found that the non-expansion states have rural hospitals that are 62% more likely to close than in states with Medicaid expansion. And around half of rural hospitals already conduct their operations with negative margins. So with this slashing of Medicaid, you're not just stripping tens of millions or millions of Americans of their health care coverage. It's not just that they lose insurance. You're devastating communities, rural communities.
I mean, better outcomes for women and infants, and nearly 50% in rural areas covered by Medicaid. And this is the same administration that acts like it's natalist or something like that. No, it's eugenicist.
Exactly. And J.D. Vance is that guy, right? He acts like he's the exception that came out of poverty because of how talented he is. But for everybody else, it's time to make them a little bit more desperate so they can become a guy like J.D. Vance. The guy who changes his name and religion several times as he climbs the ladder and turns his back on the people he supposedly represents. He's the bad kind of class traitor. Exactly. But to wrap up here, just about how important Medicaid is. Medicaid, there are around 7 million Americans over 65 years old who are enrolled in Medicaid. You may ask, well, why is that the case? That's when Medicare kicks in. But Medicare only pays for short-term nursing home stays. Medicaid pays for longer-term nursing home stays for low-income people. What happens when that goes away? Elder care is already so expensive that it's literally like putting these older people's kids into debt. It's and the places where lower income people even go and can use Medicaid payments, oftentimes they're rife with abuse. The system is already sadistic. On top of this, we're attacking nursing home care for that 7 million cohort, those 7 million people over 65 who are enrolled in Medicaid and likely need that additional assistance on top of their Medicare to take care of their health care at that stage of their life. And, this is going to not only hurt mothers and elderly people, but like you said, this is a slashing of the investment to our public health facilities. And we have been doing this for too long, actually. And this is just an acceleration of the lack of investment that we need to keep these hospitals alive. That's why when Bernie Sanders was running, he's talking about what we can do to support rural hospitals. It's sick that, the small town that my mom was from had a hospital in the 70s that it doesn't anymore. Like, we're going backwards. Society is decaying around us. And remember how we talked about this too within the context of public schools and why public schools are such a threat to Republicans and why there are a bunch of Republican states trying to curb free school and public lunches, and they attacked Tim Walz for expanding that in Minnesota. Hospitals, schools, these are like the very few pins that are holding communities together. Yep. And that's a threat to Republicans. It's a threat to conservatives. When you have community and you have shared understanding and you have centers of society that are state funded and are not for profit, you are a threat to the conservative project. And that's why they're targeting all of these institutions.
Hey, folks, don't forget to hit the subscribe button and check out our daily show. We do it every day at 12 p.m. Eastern for about 2.5 hours. We even take phone calls. You should check that out.